My name is Tancredi. I am the practice development lead here at Hint Health. I also run Medicava, and we've been helping practices grow. So I'm super excited to be talking to this conversation about managed service organizations. And I'd love for you guys just to do like a quick background on like who you are, where you're practicing, and how you got here today.
Jonathan Bushman, DO. I'm a family practice in Enid, Oklahoma. It's a community of about 60,000 people. It's an Air Force community. Been in practice since January of 2019, so coming up on 5 years. I was in fee-for-service for 5.5 years, so I'm almost entirely doubled my career in DPC, which is great.
I'm Dr. Rob Lamberts. I am a med-peds physician practicing in Augusta, Georgia. I started, I founded a fee-for-service practice back in 1994 and was in it for 18 years and had a kind of a traumatic divorce with my partners at that point in time and was looking for something to do, and a guy named Dave Chase contacted me, and we started chatting, and he told me about Garrison Bliss and what they were doing in Seattle. And so I talked to Ryan Newhofel and other folks, but just basically made it all up about 11 years ago, and been growing ever since.
Awesome. And so for the folks that aren't aware, like what is an MSO?
So I'll take that. So it's a management service organization. So we're basically providing that management arm for our clinic partners. So in order to help them still maintain their own independent entities, and kind of the midway between an employment and a complete independence is the way I think of it.
And when we think about your journey, like how did you make the transition from being an independent practitioner to like helping inspire other docs through this MSO kind of journey?
Actually, yeah, if you could put my timeline up, I can explain what happened as far as my practice goes. My timeline up?
Yep.
There it is. So 2013 is when I founded my own personal practice. And again, what happened for me was I started out as a solo doc. And honestly, I was kind of scarred by the whole partnership thing. I was wanting to be a solo doc. And so we grew, but grew very slowly, and basically took a bunch of folks from my old practice. And I was actually the very first customer for Hint. And actually I told, when Zach and Graham called me up and asked me about this idea they were having, I told them they were nuts. And that I'm glad they didn't listen to me. Just be grateful that they didn't take my advice. But anyway, I kind of never had intention of growing big. I never had intention of becoming something more than just a solo doc. I was very happy doing it. I love my practice. But about 5 years ago, I was approached by a doctor and a PA who were working together and were disaffected doing urgent care. And I didn't know these guys. They seemed real nice, and they really wanted to do direct primary care. And they thought I was going to kind of give them a little bit of advice, but I was like, oh, yeah, that's great. I need you to do that. And so I ended up having the PA actually set up his practice with supervision from the family doc over in a suburb of Augusta. And the family doc actually joined me, and that was my first MSO situation because I didn't want to have partners. I was scarred by the whole partner experience, and so what I did is he set up his own LLC. I had my LLC. He was working in my office, paying half of my rent, paying half of my nurses' overhead, all of that stuff. So I got a check back every month for him working in my office. And that idea, I think, is kind of the very minimalist, the micro, you hear about micro practice. Well, that's a micro MSO. Basically, we covered all his services. We showed him how to do everything, and it was, and you can see, at 2018 when they came, it was just me at 600 members. 2019, joined by those docs, the doc and the PA. By 2020, we were up to 1,200 members. And now we're at 2,300 members, 7 clinicians, and we just opened our 3rd location. We have actually merged those LLCs now, and so right now I'm not doing the MSO model, but our practice is absolutely open to doing that and is planning on doing more of that type of stuff.
Yeah. Thank you. Dr. Bushman.
Yeah, so my journey into the MSO was not really a journey, it was a push. 5 years ago this month is when I walked into my hospital and gave them my resignation. Yes, thank you. A little bit of trivia and a little bit of a fun memory that I had just this morning was that when I approached my, at the time, banker, and gave them my business model in detail with my pro forma, it took them 4 weeks to finally say no. And they told me, I just think this is a big metropolitan thing. Like, I don't think this will work in our community. That banker will be a new patient next Wednesday. Yes. And his physician is standing right back there, my newest clinic partner, Dr. Chuck Jansen. And he's a month into DPC. He left the hospital system with no job and no plan. He was that burnt out. And because I had been there and I knew what that felt like, I reached out to him and I've stayed in contact with him. We've known each other for a decade. And 6 months after he left the hospital, I found out that I was the only clinician in our community who'd reached out to check on him. And so we talk about the language of compassion and what DPC is for compassion. And for me, the model of the MSO is simply rescuing my colleagues, right? Mm-hmm. They've got to have an avenue to get into practice. And some of them have been burned by partners. Some of them have been burned by employment too. And so, there's the middle ground too, where it's like, I don't want to recreate everything, and I also don't want to be employed, but is there another option for me? And that's really what we want to do.
And we want to take advantage of our expertise because, we're experts at running a DPC practice or doing it right. And so to be able to utilize that knowledge and use it to grow DPC locally and maybe make a little extra money.
Yeah. So that was September, 5 years ago I resigned. In November, over Thanksgiving break, I had a PA within the same hospital system that called me. And she said, hey, I have this feeling they're going to close my clinic. She is in a community of 1,300 people. Apparently they were upside down at the hospital on her, and so they were looking to close her clinic, and she got word of this. And over Thanksgiving break, she calls me, says, what is this thing you're doing? I explained it to her. We had a 15-minute conversation. The next day, she texts back. She said, I haven't slept all night. Can I get in? Can I do this with you? But there's one contention. I do not want to be employed. And I was like, okay, sure. We're opening in 5 weeks, right? My own in 5 weeks. She's an hour away from me. Long story short, a few phone calls, some heavy work. In those 5 weeks, she opened the same day I did, January 2nd, 5 weeks later. Wow. In the same clinic that had been leased by our hospital system. They ended the lease on 12/31. We continued the lease on 1/1. Yes. Same space. She's in a community of 1,300, as I mentioned. She's had consistently almost 500 members in her practice for 5 years as a PA by herself up there. I supervise her. But they have an FQHC 2 blocks away with a physician and 2 mid-levels. And she carries that. So if anyone ever asks, or if a banker ever tells you that this is not possible in your small community, we're here to tell you that it absolutely is.
Amazing. I feel like sometimes, the universe just allows us to follow the nudges, right? And now we're here, generation 1. to help build the cities of Generation 3, to Kenneth's point yesterday morning. And there's so much knowledge and wisdom in this space that people can really tap into. So we talked about the folks that are burnt out, the ones that are like struggling. Tell me, like, what's the difference about considering, for those that are DPC interested, between like considering employment and then working with somebody like in an MSO type organization?
It depends on two things. Employment is a contractual relationship that's pretty tight, and if you hire somebody, you got to be able to fire them, and that's a hard thing, especially when you're with another clinician. Mm-hmm. On the other hand, if you really feel like it's a good fit, if you happen to know the person well, actually, again, with Ed and Davis, I got to know them over a few years and decided that we would form the partnership. We would form Welcome Health, but there are people who approach you and you don't know how good they are. You don't know what their personality is. And again, I got burned hiring a physician back in the day who ended up betraying me, basically, in that circumstance, and that's what kind of led to my business divorce. And so you got to be careful. And MSO just says, look, I'm going to give you the knowledge that I have. I'm going to give you parts of my services, and it can be an a la carte thing. It doesn't have to be one level that you do it at. But it gives you the option of still supporting DPC without necessarily getting yourself into a marriage you don't want to be in. And by the way, I just got married, so my wife is out there. So.
Yeah, I think it comes down to the individual as well. So I've had several conversations over the last few years, one actually very, very recently in the last couple of weeks. And that conversation started with, I'm done, I'm leaving my job, is there a place for me? And I treat my colleagues like I would treat my patients, like I think we should treat everyone in medicine. It's transparency. So I'm very, very clear that at the end of the day, you've got to do what's best for you and your family. And if that's working with us or if that's working with someone else, I'm okay with that, because ultimately it's going to be the best for them in the long run anyway. So I take that approach where it's like, yes, we can support, but let's be really, really clear. Let me just like start with what risk is at the front end. I'm not going to sell you, this big bag of dreams. Right. You need to be realistic about it. And in our model, we cost so little to them that it's, I think of it like our health plans that are level funded versus a full, self-funded. I mean, it's kind of an in between. It's a little more predictable risk, predictable expenses with that partnership. So the reward is a little bit better, but it's not the full reward as if you just went out and did it all entirely on your own. So it is that middle ground. And again, depending on the personality, depending on their situation and their background, sometimes we're the perfect fit, and sometimes they need to look somewhere else. Yeah. Maybe they're not ready for that.
Yeah, absolutely. The entrepreneurial journey is definitely a heavy lift. So let's talk a little bit about how you guys get to support, like with the administrative task, and like how do they actually tap into you if you're as the operator of the MSO?
That's for you.
Oh, that's for me. Yeah. So in many ways, like obviously, so on the backside of just running the contract management and the day-to-day operations and bill pay and payroll and everything else that we can do for them, I would say the big lift is getting them off the ground really well, continuing to be that support so they were just one quick phone call or email away from getting the support they need and not having to go out and try to figure it out on their own or making bad decisions. Fortunately, I think I've been the one to make all the bad decisions and learn from them. And I'm the hesitant guy, like, wait, don't do that yet, we're not ready. Don't spend that money. Don't hire that employee. I probably say no to them better than I say no to other people, and in a good way, because I'm trying to help. Like, wait, we're not ready for that. Like, you're gonna just keep in mind. That's gonna hurt your cash flow. And so there's a lot of there's just a lot of mentoring and collaborating with them. And that's part of the value of what we're bringing is like, I'm not going to let you make mistakes that are predictable, right? I'm going to avoid that for you. And then I'm going to give you some tricks that you can use to help sell on the front end. I'm going to help you understand how to make the approach to the employer, because that may be the only time you get to talk to them. They may write you off if you do it the wrong way the first time. So trying to give them that support.
Yeah.
They need that support.
Yeah, over the past year, or 2 years actually, I've been part of something called TAB, or the Alternative Board. And basically it's a bunch of small business owners that get together, and the company TAB actually sponsors this. And the small business owners serve as a board of directors for the other small businesses. And it's very useful because it's a whole, and truthfully, we've actually now got that whole board as our patient population, because they're so sold on DPC and they're telling all their friends about it. But that wasn't the reason to go into it, and that's not why I'm talking about it. The truth is, you realize nobody knows what the heck they're doing running a small business. And you know, there's a book called The E-Myth, or E-Myth Revisited, and it talks about how this woman making donuts I forget what she was making, but anyway, she was making pies, and she grew and grew and grew, and now she had to run a business to sell pies, but she didn't know how to run a business. And the idea that entrepreneurs are good at doing this, I mean, I've been doing DPC for 10 years. I'm pretty good at that, but running a business, going from a mom and pop to a real business, I mean, honestly, coming to these conferences, I kind of feel like imposter syndrome a lot of times hearing some of these things. And I say that more to encourage folks that I have as much experience as anybody does in DPC, aside from Garrison and Ryan and a couple of others. But the truth is, you hear this stuff and it's like, oh my gosh, how can I do it? And the answer is that's exactly what we're trying to do with the MSO model. That's what we're trying to do in this DPC, just to share that knowledge and say, hey, these are the lessons that I learned the hard way. These are the things that I learned going through things. And, you know, I have a saying that I beat to death for business, and that is that a good idea at the wrong time is a bad idea. And if you start living by that, you're like, oh no, that's such a good idea. Yeah. 2 years from now maybe, or maybe 2 years ago it was a good idea, but it's not anymore. And so again, the key is the mentoring side of things that you're saying.
Yeah.
Yeah, I love that. I think a lot of times, like, you go to burnout, and I like to say, like, from burnout to boredom, but boredom almost because you're, like, doing the thing alone. And why? Because you've got this amazing community and then resources like this that actually inspire through mentorship. And one of the taglines we like to say is, like, you guys get to save the lives and we save the business. And essentially that's how the MSO really gets to operate. And so for those folks that are curious and working with an MSO, I want to know, like, what are your advice? Like, how do you look for alignment in what you're doing?
You're asking alignment with potential partners?
With the MSO. Like, hey, if you're somebody who's out there that's like, I'm ready for help with the business side of things, I think it's important that you also think about the partnership, right?
You know, I think I make analogies to clinical care as a physician all the time. I look at it very similarly to a new patient. You know, if you don't know the colleague well, or even if you do know them well, it's kind of taking their history, kind of understanding where they're coming from, and really where they're trying to go. So, but I will say on the business side, I don't necessarily try to get them to go where I think they need to go. I try to figure out where it is that they want to go and where it's going to work best for them. So that's kind of my approach. But I feel the same way with businesses. You know, having those conversations with the businesses, you figure out where are you at. Where is it you're looking to go? And then I'll tell you how I'll get you there, because a lot of folks, including myself in this room, that first conversation with an employer, you word vomit about all these things you can do, and they're just like, you know, we don't need any of that. Like, that's really not our pain points. And so really it's the approach to patients, colleagues, businesses, it's all the same. It's like if you're going to help somebody, you've got to figure out where they are. You got to meet them where they are.
Yeah, and a lot of it is also does the people running the MSO, how do they run their business? Are they a high pressure, trying to make as much money as they can business, or like we are, Jonathan and I are kind of accidentally going into this side of things. We're just, again, my goal is to leave a legacy. I leave a legacy with my patients, but really a bigger legacy is to bring joy back to medicine. And so doing that is, to me, I'm 61 years old. I'm starting to think of an exit strategy, an off-ramp, but I want to have a bunch of docs in my place who are super happy, because we are super happy. We're DPC docs. And that doesn't mean you don't have crappy days. Doesn't mean that you don't have times that are hard. But overall, the difference is it's not even comparable. So really, you've got to find somebody who you align with. But I will say also, it depends on the level of MSO that you're taking. The closer the relationship, the more you got to be sure of compatibility. If it's just something more on the extraneous side of accounting services or business advice, that's not quite as important.
What's interesting, my most recent partner, I was in a hotel lobby in D.C. last September, and I got this call. It was a cold call from Southwest Oklahoma, and this provider is like, "Hey, I heard about what you're doing. I want to do this with you." And I was like, "Whoa. Like, we haven't met each other. Like, you don't know what we do. Let's kind of unravel this." And we just talked about personalities, experiences in healthcare, and our vision or mission about patient care. And that alignment took place, and then we're like, okay, now let's talk. Yeah. Like, we know that we're on the same page in mission alignment. Now we can talk, because, maybe you have different business ideas. That's cool. Sometimes I want the other business ideas because it inspires. And sure enough, that provider brought in a new business idea that we're going to take on to the other clinics. And it's like, that's perfect. That's great. You're contributing. And I wouldn't have done that myself, but now that you've done it and you're showing that it's working, perfect. You're your own beneficiary of it. Now we're all going to benefit from it as well.
And I think it's not bold to say that pretty much every DPC doc, if you're new and you're thinking, well, I'm going to start up my own practice, and if there's somebody in town, you go to that person and talk to them. If there's somebody nearby, because again, my reaction, they were expecting my reaction to be, oh, I don't know, that's competition. There's a long time that's going to have to happen before they are competition, and it's not because I'm such a good doctor. There's just so many patients. The need is so great, and we could convert every primary care doctor over to DPC in our community and still have room to spare, which is sad. We need more more primary care overall, but the truth is, this community is very helpful to each other, and a lot of it is just because of that. The idea of legacy, the idea of growing the whole movement, and that gives us more options to do stuff in the future.
Love it. And for those folks that have been in DPC for a while, that are aspiring to do an MSO type service, what would you say to them before we wrap and get some questions?
I think questions is the key. Ask a lot of questions and look in a lot of different directions. I've never regretted asking people questions, even if the answer wasn't what I was looking for or expecting. Like, it's okay. You learn. And that's, to me, one of the exciting things about the HINT conference that's different than any other conference that I go to, and different than being in the hospital, where your decision makers, this room is full of problem solvers, okay? The hospital management was full of, it seemed like, problem makers, and the problem solvers had no place in the discussion. And this room is full of the innovators. This room is full of the people who are saying, we can do better, and like Ryan Holiday says in his book, The Obstacle is the Way, that's the entire movement of DPC. The obstacle is the way. We all know what the obstacle is. It's the system. Mm-hmm. But that's also the way we're getting out of this. Mm-hmm. We're hitting it head on. We're directing our efforts together. We're collaborative. We aren't competitors. We literally get to stand side by side in this movement and be proud of each other for everything that people are doing. And you may be doing the similar things, but you're all doing it for the right reasons, and that's to serve patients better. That's what it all comes down to.
Yeah, and the other thing is that there's the saying, if you've seen one DPC, you've seen one DPC, and the same thing is true with MSO type of stuff. Be yourself. Offer the stuff you're comfortable offering, but again, understand collaboration allows you to come up with better solutions to problems, and again, some of the ideas that we're implementing now, I wouldn't have dreamed about, and also be willing to go outside of the medical community. Again, I will say the alternative board has been just an incredible thing for us, and getting ideas from employers on how to do things and being inspired by people who sell furniture for a business or pest control or whatever. But they really challenge you to I said my old the motto has always been, our mantra has always been, a good idea at the wrong time's a bad idea. I've got a new mantra, and it's run the damn business.
Yeah.
Because when it was just me, it was like, just me and my nurses, and we just kind of ran it. But now we have to really, do a good job and actually be I have to be a businessman. And that's not as easy, and it requires help. But it's not going to be like anybody else's DPC practice. It's not going to be like anybody else's MSO.
Mm-hmm.
Yeah, I love that. Thank you for bringing that. You took the kind of summary out of my head, because it is. It's like there is no one shade of MSO. You get to be of service. And a lot of times I think that the physicians and clinicians that I work with, they're looking out here for the answers, and really all the time they're just right in front of your face. And clearly you guys were called forward into this. And so listen to what people are asking for, because I think that's how you get to solve the problems at the end of the day. We could probably have time for one or two questions if we got some.
Thank you, guys. I just love John and his ability to just pass on information. And I'm in the panhandle of Texas. He's right up in Oklahoma, and I feel like him and PHP with Kyle Rickner have been just so helpful for us. And the question I have about MSOs, I really am attracted to that because I'm a very communal person, and I find it hard to supervise other physicians because I'm a very independent person myself, and I don't want people telling me how to do what I do. And that's a lot of us in this room, right, is we're independent. And so in that, how do you build in, I guess, maybe the financial part of this is how do you decide what to charge that person? I mean, yours was really easy in the beginning because you just had one person come in and you just halved everything. But is there some kind of a percentage you work off of based on operating costs? Or, I can see that the MSOs are different, where you can have almost a franchise model where you're giving them everything, including logo and marketing material, to just that business advice. So.
Mm-hmm. So, as in any business, you have fixed expenses, you have variable expenses. So one of the fixed expenses is in the model is basically a per member per month management fee. That's the variable as you grow. So it gives us incentive to pour energies into it as well. So that's not a complicated or that's a simple answer. So yeah, there's fixed and variable, and we want to align our incentives for their growth as well. Yep.
That's the magic. That's the $1 million question always. How much do I charge? How much do I charge for patients coming in? How much do I charge for, how much do I pay a new doctor coming in if I'm going to hire somebody? How do we do all that stuff? And that's the stuff you're just kind of saying, whatever I'm comfortable with. Not too much, not too little is the right answer. And it's kind of a hard answer. You want somebody to give you, this is the amount. Well, again, it really depends on the level of service you're offering, and it really depends on how much benefit it is to them, and if they can recreate it.
Yeah. Wonderful. Well, thank you, Dr. Lamberts. Thank you, Dr. Bushman. These guys are going to be around. Ask them questions, pick their brain, and there's lots of intelligence in this room and wisdom to glean from you guys. So thank you so much for being here.
Thank you for having us.
Awesome.